Another Wellness Wednesday on Health and Horsepower. This week, I want to talk about 11 treatments for headaches that do not require medication and also you may never have tried before. I don't know about you, but I have suffered from headaches since very young. I have had everything from cluster headaches to tension headaches to sinus headaches to hormone headaches to migraines, including optic migraines. And we all know that when you have headaches of many different types, they can be really aggravating, number one, but they also can really interfere with your life. I know for me, dealing with headaches has been, a really big issue for me. I used to get them on a weekly basis, like almost 3 to 4 days a week. And with a combination of treatments, everything from herbals to essential oils to chiropractic, I have been able to get those under control. And I want to share some of my tips and tricks with you because if you're like me and you've dealt with headaches, you know that you will do anything to get some relief from those. So let's talk a little bit more about locations of headaches and what that could indicate for you. So some of the causes of headaches that we see a lot in my office are lack of sleep. If you're not getting enough sleep, your body can't heal, your body can't regenerate, and a lot of times high inflammation levels in your body, if your body can't bounce back and heal like it's supposed to, can actually cause issues where you're getting headaches from that. Also dehydration. So if we have been not drinking enough water, or if we're not getting enough salt, because yes, your body needs salt for electrolyte balance, that can cause dehydration issues. So a lot of times I see people that are like, oh, I drink plenty of water, but they don't really salt their food and they're not really using salt in their diet. But the reality is there are different types of salt. So table salt is one that we've been warned against due to sodium levels and it can increase blood pressure. Yes, that is one that we want to be careful of and be mindful that that can cause other health issues and increase risk of factors for higher blood pressure, or if you have higher blood pressure or you have heart disease or any types of heart risk factors, a lot of times you're told to avoid sodium. The thing is, sodium is only one type of salt. We also have pink Himalayan salt, which has about 90 minerals in it, including trace minerals that your body needs for a lot of other functions, or Celtic sea salt, which has about 80 minerals in it. Table salt literally is just sodium chloride. So yes, it can raise sodium levels. It's also one that can affect your blood pressure and things like that. But pink Himalayan salt is a great option for those of you that are looking for a more natural salt that's also going to add some other health benefits for you. I find that pink Himalayan salt, because it does have some magnesium and some other trace minerals, it can help with a lot of different body systems and be beneficial for you. If you do have high blood pressure, I would recommend Celtic sea salt. That actually has been shown to lower blood pressure and is perfectly safe because it does not affect your sodium levels. Normally, I recommend that you want to get about half your body weight in water. So if you're 100 pounds, 50 ounces of water per day. And then I usually recommend about half a teaspoon of either pink Himalayan or Celtic sea salt is my recommendation, or an electrolyte drink like a Gatorade, or I also have a recipe to make your own electrolyte drink at home that I've shared on the channel before, which is actually a pretty funny video that Tori was in with me helping to go through that recipe. Another factor that can be a problem for people is if they're having nutritional deficiency. So certain nutrients can cause problems for you, where that's going to cause constriction of muscles or muscle spasms, or even constriction of blood vessels and affect blood flow. That can also contribute to headaches. Another one I see a lot is if we are not eating enough calories or our blood sugar is very unstable, that can also cause issues where you're getting lack of blood flow to the brain, and that can also trigger a headache. Blood flow, like I mentioned, when you're having blood sugar issues, that's going to affect blood flow. Also, if we're having muscle tension, cramps, or spasming, or we have a lot of tension due to posture, or a lot of tension due to overuse, that can also affect blood flow. Hormones also have an effect on blood flow too. So if we are noticing headaches around ovulation, which is usually about a week and a half to a week before your period, or right during your period you're having headaches, that can be an indicator that the hormones are affecting blood flow and causing those headaches for you. So tension is a big factor as well. If we have tension in the neck or in the jaw muscles or even in the tops of our shoulders, that's going to cause those muscles to constrict and restrict blood flow, which can also contribute to headaches. Certain medications also have headaches as a side effect. So if you are taking some medications that could be causing some side effects, I usually recommend going to drugs.com. There is a medication interaction checker. You can actually plug your medications in, It'll tell you what to look for in some interactions between those medications as well as food, and give you some clues as to what to look out for and when to talk to your doctor. Another possibility with headaches is we could have like an organic issue or a serious medical problem like a tumor or a blood clot or a brain injury from a trauma, or even a stroke could be happening when we're having neck and headache pain. So I usually recommend making sure you're kind of ruling everything out. But if we are having symptoms of vision changes, where you've lost vision, or if you're having vomiting, or if you're having a really high fever, or it's the worst headache you've ever had in your entire life, I definitely recommend getting that checked out to make sure it is not something more serious. But most of the time, I find when people are coming in my office, if they're complaining of headaches that are kind of all over their head, a lot of times for me, I find that that can be related to weather change. So a lot of times as the weather changes and goes hot to cold, the muscles and also the bones of your skull do expand and contract. And sometimes when they contract back down, they can overlap. And that overlapping at the sutures can cause pressure and cause kind of pain across the head. Also, hormone headaches can kind of have that similar feature. If you're having a headache kind of all over your head, it's not a specific area, that's an indicator, like I said, weather change. Hormones can also be a factor with that. If you're tending to have pain more like in the neck or the back of the head or the tops of the shoulders, usually that could be more of that tension blood flow restriction. A lot of times when I'm asking patients in my office, if you're having a headache, start there. Does it go up to the top of your head? Usually that's more blood flow. If it's coming around the side or across the top of the ear, that's usually more related to muscle tension. So if you're having any symptoms where you're getting that to the top of your head or over your ear, a lot of times that may be related to blood flow, muscle tension, and that's definitely something we can help with in our office. I've also had a lot of patients that have complained of pain behind their eye, or even at like the jaw area. That can also be related to tension due to neck and jaw issues. Or in some cases, we also have some of those cranial sutures on our face. You have a lot of different bones that come together right in here. So when we're having pain around our eyes or under our eyes or around our nose, that can be related to sinuses and weather change. But we also can do some things in our office with acupressure. So that means we're putting pressure, no needles with that, or even massage can help to open that up and relieve that. So let's get down to it. I want to share, like I said, 11 tips and tricks with you that you may never have tried before specifically for headaches. So I mentioned and kind of talked about some of these already. We definitely want to make sure we're getting enough water and electrolytes. So again, you want to aim for half your body weight in ounces and about half a teaspoon of pink Himalayan or Celtic sea salt or an electrolyte drink per day. We can also use ice and heat as well to help with relieving tension and restoring blood flow. So I like to recommend what I like to call the ice sandwich, where you're going to put basically heat between your shoulder blades, ice at the base of your neck, and then heat kind of right around the forehead or tops of the ears. That's going to help to relax the muscles in the neck and shoulder so your blood flow gets up to your head. This reduces swelling with the ice there so it can get into your head, and then the heat helps to distribute that blood flow a little bit better and relieve any tension over the sutures or the muscles that overlie your skull. So that's another big thing that can really be helpful. The third thing is magnesium. I don't know if you've heard of magnesium before. We need calcium to contract our muscles and magnesium to relax them. Magnesium has been shown in a lot of different studies to be helpful, not only for brain injury and trauma, but it's helpful because it's used in 300 different enzyme reactions in your body. Everything from digestion and hormone balance to muscle function, heart function, even regulating your blood pressure and your heart rate is related to magnesium. So when you take magnesium, that can relax the muscles, relax the blood vessels to lower blood pressure, and it's also really helpful for migraine. Migraine users have found, some of the studies have shown about 600 milligrams a day. That's a lot to take at once, so I usually recommend, because magnesium is water soluble, it goes through you kind of quick if you take too much. So I recommend starting with like 200 in the morning, 200 at night. If you don't have a loose stool, then you can kind of go up from there. I usually recommend going up about 100 milligrams. Once you find a dosage that causes a loose stool, you want to go one down from that. So say 700 milligrams cause loose stool, 600 is your magic number for what your body needs to actually work and function. That's what's being absorbed. The fourth thing is making sure you're getting enough sleep. So we want to make sure we have a bedtime routine in place. We want to be doing calming activities, trying to avoid blue light, avoid stimulation at nighttime, and have kind of the same routine where you're getting ready for bed, dimming the lights, making sure that you are not watching TV or blue light and getting, kind of doing things that are not related to sleep in the bedroom. Because when you are really hyped up, stressed out, working, watching TV, watching scary movies and stuff like that in the bedroom, a lot of times your body views that bedroom as stimulation rather than helping to calm down. So I definitely recommend kind of getting that kind of routine in place where you're dimming the lights, kind of calming down, maybe doing a hot or warm drink at nighttime, and then kind of getting that same routine so that you're getting to sleep. If you are going to be reading, I usually recommend making sure you have indirect lighting, so lighting not directly on you, but maybe pointing at the wall and bouncing off, or put a scarf over your bedside lamp. Try to avoid fluorescence as much as you can. If you are going to be watching TV or on your phone, try to turn the brightness down as much as possible. If you're reading a book on your phone, I recommend turning it to the black screen and also doing a night light, which removes the blue lighting as well. The other thing is darkness. So I kind of talked about this already, but when we are using darkness, that is going to, number one, not cause stimulation, but a lot of times that darkness is going to help us relax. It's going to help us breathe. It's going to help you kind of get into a sleep mode or kind of bringing you down from a high. Darkness also helps, especially if you're having migraines, to let your body kind of just sit in the darkness, sleep, rest, and avoid stimulation. The sixth thing that I want to talk about is avoiding histamine foods. So certain foods have high levels of histamine, which are inflammatory products. So cheeses and fermented foods, beer, wine, smoked fish, and also cured meats, especially those with nitrates in them, can be big problems for you. So I usually recommend, focusing more on water and healthier foods, trying to avoid any processed foods as much as possible. The second thing that can be really helpful is peppermint oil. Peppermint oil can be applied in a carrier oil. They also make really cool like roller ball ones that you can put over your temples or the base of your neck to help relieve and reduce swelling, and that can help with a headache too. Just be careful you don't get it in your eyes. I have a story about that that is really brutal for poor Miss Tori. When she was younger, she got peppermint in her eye, and it was awful. So whatever you do, don't get it in your eye. But make sure you can use it in a roller ball, or like I said, you can also mix it up into a carrier oil and just apply like a drop on your temples or at the base of your neck and kind of massage that in to help reduce some of that inflammation. The number 8 thing I want to talk about is some herbals that can be really helpful as anti-inflammatories and also helping your body relax. So one that I know we've talked about, I swear until I'm blue in the face, quercetin. Quercetin is absolutely amazing. It actually is an anti-inflammatory that works by stopping your mast cells or your white blood cells from releasing inflammatory products. So it's going to help to reduce swelling before it even happens in the first place. Willow bark is also really great. You can actually brew willow bark in a tea. I know me specifically, I'm not a big fan of willow bark by itself in a tea, but a lot of times I'll mix it with a chamomile and some honey. And a lot of times I'll kind of make that like a coffee. So I might even add a little bit of creamer in there. Just to give a little bit more flavor. But that willow bark is, again, another natural inflammatory that actually helps to block pain signals and inflammation. That's what aspirin actually is derived from without having the side effects. Now, willow bark tea is not for those kiddos that are under 12 years old. So definitely for them, I would say avoid it because it can cause Raynaud's syndrome as well as a number of other issues for kids. So I don't recommend that for kids under 12, but that can be really great for you. For kids under 12, chamomile would be a great option. You can also do peppermint in a tea. And like I said, quercetin is a great option too. The number 9 thing I want to talk about is what you can do to help relieve tension. So doing stretching and massage and yoga motions for the neck and upper back and shoulders can really helpful to kind of loosen up the muscles. You can also do massage on your face. So usually I recommend kind of starting at your temples and going back over the tops of your ears and then going from the temples down towards your lips, kind of in a hockey stick style shape. And then also going down the sides of your neck and top of your shoulders. You can use your hands for that. You can use a knobble, which is kind of like a pressure point that you can use and kind of hold and press. You can also use a massager if you have one at home. The vibrating style massagers are nice. They also have a lot of different Theragun style ones out there too that are really great for that. Another thing can be really helpful is a lot of times when we have a headache, we don't want to eat, but when you don't eat, your blood sugar drops, and that causes another trigger that can make that headache worse. So you do want to make sure you're eating, even if it's small amounts or a couple bites at a time, about every 3 to 4 hours, you want to keep your blood sugar up. Usually, if you are having nausea along with your headache, I do recommend like a Gatorade or crackers, just to make sure you're getting something in your body to help with blood sugar balance. And then the last thing that you may never have tried or even heard about is chiropractic care. So in my office, I do non-rotational adjusting. So no twisting, no snapping, no popping, none of that. You get to relax. And as I do the adjustment, the table moves so that we can move and relieve tension on the joints and the muscles and restore blood flow to help with your headaches. I have a lot of patients that have had 20, 30 years of migraines and headaches and had no relief from it. we start doing treatments in the first 2 weeks, they notice that their headache time cuts in half or the severity cuts in half. So we can get some pretty quick results in our office. So if you want more information about how we can help with that, you can check out our website, freedompeoria.org. You can sign up for an appointment on there. And later this year, we're going to be offering another online course about headaches, which I'm really excited for. So in the meantime, make sure you check out our other videos. I will include a link for the electrolyte video I was talking about for you to make your own electrolyte drink at home. In the meantime, have a great rest of your week, and we'll see you next week on Health and Horsepower. Before we go, I have one question for you. Actually, a favor to ask. If you've been dealing with headaches for a long time, what treatments have you tried or what things have you done at home that I didn't mention that might be helpful for other people that are watching this video? Pop it down in the comments so we can help other people with some tips and tricks you have learned yourself from having headaches.